Hello again, my name's Gabe Zolna. You know, if you watch some of my earlier videos on Obamacare, I said it was never intended to work, it was designed to fail. And guess what? The design's working, it's failing. I did a couple of videos and I spoke about United Healthcare dropping out of Obamacare. Apparently they've lost $1 billion. $1 billion. And the majority of people that buy Obamacare don't understand necessarily what they're buying, and they find out the painful way. They find out that they've got a $5,000 deductible, meaning that they don't receive a dime until they've expelled the first $5,000 for the kind of treatments that they need. And yet they're paying an exorbitant amount of money for the insurance. And guess what's going to happen with United Healthcare dropping out? Well, premiums are going to skyrocket. They right now provide coverage for 800,000 people, if you want to call it coverage. And the question that was asked of Dr. Charles Krauthammer by Brett Baer is, well, where do you think this is all headed? You think Hillary's going to be talking about Obamacare? And Krauthammer said what I've said from the very beginning. Obamacare was never designed to work, it was designed to fail. And what's going to take its place is single payer. Now what that means is there'll be no Blue Cross, there'll be no Aetna, there'll be no Humana, there'll be nobody but the federal government, just like in Canada. Now, the Canadian system, as good as it is pretty lousy. And the reason that it's lousy is that if you have a requirement for some kind of major surgery, well, you're going to get in line and you'll probably be dead. It'll be treated the same way as the VA treats the veterans. Many die before they get to see a doctor. The same thing happens in Canada, and the same thing's going to happen here in the United States. It's headed to single payer, which is what it was always designed to do. But Obama couldn't come out and say that at the beginning, because it never would have been accepted by the American people. So the American people were eased into the transition. And they had no idea as to these various plans and the deductibles and the premiums associated with these plans. It was never designed to work. If you take a look at all the money that was spent on the software, on everything else, Obama could have given each American a couple of $1 million, and they still would have saved money. This flappy-eared jackass, his plan worked perfectly. He destroyed 1/6 of our economy. It worked perfectly. Now, who really got screwed were the insurance companies, because they're all going to be gone. There'll be no United Healthcare. Never mind the dropping out of Obamacare, they'll be nowhere. They're all going to be gone. That's always been the plan. But then again, a lot of us will be gone too. So really, it doesn't matter, does it?